Bismillahirrahmanirrahim. BSN third semester pharmacology unit number 2 fast reading very important chapter. बस आपने carefully सुनना है. Okay, objective at the end of this lecture, the student will be able to define pharmacokinetic, pharmacodynamic, discuss half-life and bioavailability, describe factors affecting bioavailability, various mechanisms through which drugs exert their action in the body, explain therapeutic index. What is pharmacokinetics? Kinetics mean के बॉडी ड्रग पर क्या रिएक्शन करता है. उर्दू में जस्ट ये है. फार्माकोकाइनेटिक्स इज द स्टडी ऑफ एब्जॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म एंड एक्सक्रीशन ऑफ ड्रग. व्हाट द बॉडी डज टू द ड्रग. ग्रीक काइनेसिस मीन मूवमेंट. द प्रोसेस बाय विच द ड्रग इज absorbed, distributed, metabolized and eliminated by the body. Once drug is administered, it is absorbed, entered the blood, is distributed to different parts of the body, reaches the site of action, is metabolized and then excreted. 4 phases में हो जाता है. Drugs may be transported across the membrane by passive or active transport. Passive transport mean no energy. The drugs moves across the membrane without any need of for energy. Active transmit energy होता है. It is the transfer of drug against the concentration of drug against the concentration gradient and needs energy. It is carried by the specific carrier protein. Pharmacodynamics. Pharmacodynamics is the study of the effects of the drug of the body and their mechanism of action. What the drug does to the बॉडी. फार्माकोडायनामिक्स का मतलब होता है कि ड्रग्स बॉडी के साथ क्या करता है. इसको स्टडी करने के लिए फार्माकोडायनामिक्स है. द इंटरेक्शन ऑफ द ड्रग एंड द रिसेप्टर रिस्पॉन्सिबल फॉर इट्स एक्शन इन द बॉडी. Pharmacokinetic, the life cycle of the drug: absorption, distribution, metabolism, degradation or excretion. 4 phases. What is absorption? Is defined as the passage of the drug from the site of administration into the circulation. For a drug to reach its site of action, it must pass through the various membrane depending on the route of administration. Absorption occur by one of the process: passive diffusion or active transport. The exert for IV route. Absorption is important for all other routes of administration. Factors affecting drugs absorption. Several factors influence the rate and extent of absorption of the drug. They are disintegration and dissolution time. Number 2, formulation. Particle size. Small particle size is important for better absorption of the drug. Important point. Lipid solubility. Lipid soluble drugs are absorbed faster. Area and vascularity of the absorbing surface. Gastrointestinal motility. Presence of food. Drugs may form complex with the food, such complexes are poorly absorbed, e.g. tetracycline, chelate, calcium present in the food, so absorptions decrease. pH and ionization. Ionized drugs are poorly absorbed while unionized drugs mean lipid soluble chidi are well absorbed. वो जो कम ionized दी अगर न absorb की वो absorb नहीं होता. Acidic drugs remain unionized in acidic medium of the stomach and rapidly absorbed, e.g. aspirin, barbiturates. Basic drugs are unionized when they are reach the alkaline medium of intestine from where they are rapidly absorbed. Penicillin या ephedrine. Metabolism. Some drugs may be degraded in gut, e.g. nitroglycerin या insulin. Disease. The disease of the gut like malabsorption and acycloria result in reduced absorption of drugs. Slow absorption. Orally swallowed through the mucous membrane, oral mucosa, sublingual, nasal mucosa, insufficient topical, transdermal, through skin or rectal suppository. Fast absorptions, parenteral injections, intravenous, intramuscular, subcutaneous या interperitoneal या inhaled through. First pass metabolism. First pass metabolism is the metabolism of the drug during its passage from the site of absorption to the systemic circulation. It is also called pre-systemic metabolism या first pass effect. Drugs given orally may be metabolized in the gut wall and in the liver before reaching the systemic circulation. The extent of first pass metabolism differ from the drug to drug. First pass metabolism may result in parietal to total inactivations of the drug. When it is partially, it can be compensated by giving higher dose of particular drug, e.g. nitroglycerin या salbutamol. बायो अवेलेबिलिटी एंड बायो इक्विलेंस क्या होता है? बायो अवेलेबिलिटी मीन ड्रग में कितना ड्रग की कंसनट्रेशन है. बायो इक्विलेंस मीन टू ड्रग्स का कितना कंसनट्रेशन प्रेजेंट इज कॉल्ड बायो इक्विलेंस. बायो अवेलेबिलिटी मीन इज द फ्रैक्शन ऑफ द ड्रग दैट रीचेज द सिस्टमिक सर्कुलेशन फॉलोइंग एडमिनिस्ट्रेशन बाय रूट IV 100%. IV का 100% है. बायो इक्विलेंस मीन्स स्टडी ऑफ कंपेरिजन ऑफ बायो अवेलेबिलिटी ऑफ डिफरेंट फार्मूलेशन ऑफ द सेम ड्रग्स. Bioequivalence mean two drugs are said to be bioequivalent if they have the same bioavailability efficacy provided that they are administered in the same molar doses at the same route. Importance of bioequivalence: it is necessary for generic substitutions. Generic products are usually cheaper than brand product. This is the diagram. Factors affecting bioavailability क्या factor हैं? Physical property of the drug solubility, the drug formulation, gastric empty time, condition of GI tract, pH in the stomach, first pass effect, morphine, isosorbide, denitrate, surface area for absorption, drug interaction, antacid and clarithromycin, drug food interaction. ये सारे पॉइंट ज़रूरी हैं. Distribution: after a drug reaches the systemic circulation, it gets distributed to various tissue. It should cross several barriers before reaching the site of action. Like absorption, distribution also involve the same process: filtration, diffusion and specialized transport. Various factors determine the rate and extent of distribution. They are lipid solubility, ionization, blood flow and binding to plasma protein. Unionized and lipid soluble drugs are widely distributed throughout the body. What is metabolism? Metabolism or biotransformations is the process of biochemical alteration of the drug in the body. Body treats most of the drugs or foreign substance and tries to inactivate and eliminate them by the various biochemical reactions. These processes convert the drugs into more polar water-soluble compounds so that they are easily excreted through the kidney. Some of the drugs are largely unchanged in urine, e.g. Furosemides, atenolol. Mainly drugs are metabolized in liver. Some are metabolized in kidney, lungs and blood. The chemical reaction of biotransformations can take place in two phases: phase 1 and phase 2. Phase 1, non-synthetic reaction, convert the drugs to more polar metabolite by oxidation, reductions or hydrolysis. If the metabolites are not water soluble, it undergo phase 2 reaction. Phase 2, synthetic reaction. In this reaction, water-soluble substance present in the body like glucuronic acid, sulfuric acid, and amino acid combine with the drug to form a highly polar compound. So excreted by the kidney, large molecules are excreted through the bile. Excretion: the major organ of excretion are kidney, intestine, biliary system and the lungs. Drugs in small amount are excreted in saliva, sweat and milk. Renal excretion: kidney is the most important organ of a drug excretion. Highly lipid soluble drugs are reabsorbed in the renal tubules so that excretion is slow. Unabsorbed portion of the orally administered drugs are eliminated through the feces. Large water soluble conjugates are excreted in bile. The lungs are the main route of elimination for gases and lipids, GA alcohol. Plasma half-life. Plasma half-life is the time taken for the plasma concentration of a drug to be reduced to half its value. Minimum dose means smallest dose required to produce desired therapeutic effect of the drug. Maximum dose is the largest dose of the drug that can safely given to the patient without producing harmful effect. Toxic dose is the dose of the drug which produce undesirable effect in majority of the patient. It's called a toxic dose. Lethal dose means the dose of the drug which can cause death. It's called lethal dose. Lethal dose of the पिनोबार्बिटोन इज 610 ग्राम. ये ड्रग पर डिपेंड करता है जो पेशेंट को मार देता है. टॉक्सिक मीन जो इन्फेक्शन काज करता है. मैक्सिमम डोज ज़्यादा आसान चीज़ें हैं. दिस इज़ द ग्राफ. factors affecting half-life: renal excretion, liver metabolism, protein binding. Pharmacodynamics, ड्रग क्या असर करता है बॉडी पे? Pharmacodynamics is the study of the action of drugs on the body and their mechanism of action. To know what drugs do and how they do it, drugs produce their effects by interacting with the physiology system of the organism. By such interaction, drugs can only modify the rate of functions of the various system. Drugs may increase or decrease the secretion. Action of drugs: these drugs act by stimulation, depression, irritation, replacement, anti-infective or cytotoxic action या modification of the immune status. ये इसी तरह ड्रग्स एक्ट करता है बॉडी पे, जिसको हम फार्माकोडायनामिक्स में स्टडी करते हैं. स्टिमुलेशन कैसे करता है? इज़ द इंक्रीज इन एक्टिविटी ऑफ द स्पेशलाइज्ड सेल्स, ई.जी. एड्रेनलिन स्टिमुलेट द हार्ट. डिप्रेशन किस तरह करता है? इज़ द डिक्रीज इन एक्टिविटी ऑफ द स्पेशलाइज्ड सेल्स, quinidine depress the heart. Irritation, this can occur on all types of tissue in the body and may result in inflammation, corrosions, and necrosis of the cells. Replacement drugs may be used for replacement when there is deficiency of a natural substance like hormones, metabolites, or nutrients, insulin in diabetes, iron in anemia, vitamin C in scurvy. Anti-infective and cytotoxic action: drugs may act by significantly destroying infective organism. Penicillin, cytotoxic effect on cancer cell. Magnification of immune status: vaccine and sera act by improving our immunity, while immune suppressant act by depressing immunity. Glucocorticoid. Mechanism of action of drug may act by one or more complex mechanism of action. Fundamental mechanism of drug action may be through receptor काम करता है, through enzyme and pumps करता है, through ion channel करता है, through physical action करता है, या chemical interaction करता है, या altering metabolic process करता है. Through the receptor कैसे काम करता है? Drugs may interact with specific receptor in the body, या through enzyme and pumps. Drugs may act by inhibition of the various enzyme, altering the enzyme's mediated reaction. Captopril inhibit angiotensin converting enzyme. Through ion channel, drugs may interfere with the movement of ions across specific channel. Calcium channel blocker है, ये potassium channel blocker है. इसी तरह फिजिकल एक्शन किस तरह करता है? द एक्शन ऑफ द ड्रग could result from its physical property. Absorptions activated charcoal in poisoning. This is the physical action. Chemical alteration कैसे करता है? Drugs may act by chemical reaction. AG antacid neutralize gastric acid. Altering metabolic process: drugs like antimicrobial alter the metabolic pathway in the microorganism, resulting destructions of the organism. Sulfonamides interfere with bacterial folic acid synthesis. Receptor: a receptor is a site on the cell with which an agonist binds to bring about a change. Receptor are protein. They may be present in a cytoplasm or on the nucleus. ये सेल मेम्ब्रेन पर भी, न्यूक्लियस पर भी, कहाँ भी हो सकता है. Receptor functions of receptor: the receptor has to identify the compound, and when the compound binds to the receptor, it has to convey the message to bring about a response. Agonist क्या होता है? जो increase करता है. Antagonist जो कम करता है. Agonist is a substance that binds to the receptor and produce a response. Antagonist is a substance that binds to receptor and prevent the action of agonist on the receptor. Partial agonist mean it binds to the receptor but has a low activation. Drugs synergism and antagonism. Synergism, when two or more drugs are given concurrently एक जगह, द इफेक्ट में भी एडेक्टिव होता है, या साइनर्जिस्टिक होता है, या एंटागोनिस्टिक होता है. एडेक्टिव मीन जब 1 + 1 होता है तो उसका आंसर 2 होता है. अगर साइनर्जिज्म में 1 + 1 उसका जवाब 3 आए तो ये साइनर्जिस्टिक है. अगर एंटागोनिस्टिक है तो 1 + 1 2 होता है तो इसका अगर आंसर 1 आए तो ये एंटागोनिस्टिक है. ये इसे मैं आसान कर रहा हूँ. एडेक्टिव इफेक्ट मीन द इफेक्ट ऑफ द 2 or more drugs get added up and total effect is equal to the sum of their individual action, e.g. ephedrine with the theophylline is a bronchial asthma. Synergism, when action of one drug is enhanced facilitated by another drug, the combination is synergistic. Here is the total effect of the combination is greater than the sum of their independent effect. It is often called a potentiation या supra-addictive effect, e.g. acetylcholine या physostigmine. Antagonism: one drug opposing or inhibiting the action of another drug is antagonism. Based on the mechanism, antagonisms may be chemical antagonism, physiological antagonism, antagonism at the receptor level, reversible or irreversible. Chemical antagonism: two substances chemically interact to result in inactivating of the effect. Antacid like aluminum hydroxide neutralize gastric acid. Physiological antagonism: two drugs act at different sites to produce opposing effect. Insulin and glucagon have opposite effect on the blood sugar level. Antagonism at the receptor level: the antagonist inhibit the binding of agonist to the receptor. Such antagonisms may be reversible or irreversible. रिवर्सिबल कॉम्पिटिटिव एंटागोनिस्ट या इरिवर्सिबल एंटागोनिज्म. अच्छा, रिवर्सिबल कॉम्पिटिटिव एंटागोनिस्ट मीन सेम रिसेप्टर का क्या होता है, मुकाबला होता है. द agonist and antagonist compete for the same receptor. By increasing the concentration of the agonist, the antagonism can be overcome. It is thus reversible antagonism. And acetylcholine and atropine compete at muscarinic receptor. The antagonism can be overcome by increasing the concentration of acetylcholine at the receptor. Irreversible antagonism: इरिवर्सिबल का मतलब होता है जो वापस नहीं होगा. एंटागोनिज्म की बात उसको क्या करता है, रिवर्स करता है, स्टॉप करता है. एंटागोनिज्म बाइंड सो फर्मली बाय कोवेलेंट बॉन्ड to the receptor that is dissociate slowly or not at all. It block the agonist. The blocked cannot be overcome by increasing the dose of agonist. Hence, it is irreversible antagonism, e.g., adrenaline and phenoxybenzamine at alpha adrenergic receptor. Drug effectiveness: dose response (DR) curve show the relation between drug dose and magnitude of drug effect. Drugs can have more than one effect. Drugs vary in effectiveness, different site of action, different affinities for receptor. The effectiveness of drug is considered relative to its safety therapeutic index. This is the therapeutic effective dose. Dose at each 50% population show response is called effective dose. और lethal dose का मतलब होता है 50% population उसको डाई किया होता है. अच्छा, therapeutic effective dose in 50% of population. Potency: relative strength of response for the given dose. Effective concentration in the of agonist needed to elicit half of maximum biological response of the agonist. The potency of an agonist is irreversibly related to its what is efficacy. Maximum possible effects regardless of the dose is relation to its agents indicated by peaks of DR curve. Full agonist 100%, partial 50%, antagonist 0%. Tolerance या desensitization: decrease response to same dose with repeated constant exposures. More drug needed to achieve some same effect. Right word shift. Tachyphylaxis mean is the rapid development of tolerance when some drugs are administered repeatedly at the short interval. Tolerance develops rapidly and is a tachyphylaxis या acute tolerance. जब आप एक मेडिसिन दोगे तो उसकी बॉडी में टॉलरेंस पैदा हो जाएगा, फिर उस पर असर नहीं करेगा. Mechanism of tolerance: changes in drug availability at the site of action, decrease bioavailability, decrease absorptions, increase binding to depot sites, changes in drug receptor interactions, down regulation of a receptor. Pharmacokinetic and pharmacodynamic: with a pharmacokinetic drug interactions, one drug effect absorption, distribution, metabolism or excretion of another. With a pharmacodynamic drug interactions, two drugs have interactive effect in the site of action. Other type of drug interactions can result in adverse effect in some individual. In terms of efficacy, there can be several types of interactions between medications: cumulative, additive, synergistic and antagonism. Cumulative effect mean 1 plus 1 is equal to 2. The condition in which repeated administration of a drug may produce effects that are more pronounced than those produced by first dose. This is the additive of 2 chemical is equal to the sum of the effects of the two chemical taken separately, aspirin या Motrin. Synergistic mean the effect of the two drugs taken together is greater than the sum of their separate effect at the same doses, e.g. ampicillin and gentamicin is treating bacterial infection. एंटागोनिज्म मीन इसको कम कर देना. इफेक्ट ऑफ द टू केमिकल टेकन टुगेदर इज लेस देन द सम ऑफ देयर सेपरेट इफेक्ट एट द सेम डोजेज. नर्सेज रिस्पॉन्सिबिलिटी क्या है? इंश्योर द करेक्ट डोज इज एडमिनिस्टर्ड बाय द राइट रूट. पखी रूट बंदेवर के हिस्ट्री ऑफ एलर्जी तो उसको नहीं है, या मॉनिटर एडवर्स इफेक्ट उसको मॉनिटर करना है. ड्रग्स शुड बी कीप्ड इन सेफ प्लेस, पखजोई की अच्छी जगह पे रखना है. चेक प्रिस्क्रिप्शन और ड्रग लेबल एंड पेशेंट नेम देखना है कि गलत पेशेंट को कहीं ड्रग ना लगाओ. दिस इज़ अवर द एंड ऑफ लेक्चर. थैंक यू.